Joining me now is Lisa Vail, a registered nurse with Bryan Health. Thank you, Lisa, for being here. We appreciate it.
My pleasure. Thank you for having me.
Yes, and we want to get some of our viewers' questions answered. So first off, Lisa is actually in charge of the Bryan's Incident Command Center, correct?
I am.
Could you kind of talk about what the purpose of that is and explain that to folks?
Certainly. The Incident Command Center is a group that meets when there is an emergency, and we are focused on systems, space, supplies, and staff. So we look at all of these things from a critical perspective to make sure we have everything in place to deal with whatever emergency that might present itself. The folks that are on the Incident Command and are participating include the Incident Commander, our Emergency Preparedness Coordinator, a senior leader, a member of our infection prevention team for this particular pandemic, and then other providers such as our Vice President of Medical Affairs and our infectious disease specialists as well this time.
So you have quite the team involved with that too.
Yes, quite the team, 24 hours a day.
Wow. Yes, and not only do you have quite the team prepared for this, Bryan Health also has a lot of different resources for folks. Could you talk a little bit about the Easy Questionnaire or the hotline as well?
I'd be happy to. We do have the Bryan Health Easy Visit. It is a telemedicine capability to do online screening for a variety of illnesses. At this point in time, we are using it to allow individuals to be screened for upper respiratory type infections, and they can use the Easy Visit assessment free at this point in time for upper respiratory infections if they use the code COVID-19.
Okay.
And we allow them, they work through the process looking at symptoms, prior travel, age, and if they have any coexisting health conditions that might make them vulnerable or at risk for COVID-19.
I see. And the hotline, correct, is 24/7 too?
Yes, the hotline is 24/7. We have a registered nurse that's taking calls 24 hours a day, and they, on this phone call, are providing education, support, of course, to address a lot of anxiety that is out there for people who are concerned about possible exposures, guidance, and then they will also assist folks in actually completing the screening process if they choose to do so.
And I'm sure those resources help a lot with the hospitals not becoming overwhelmed or overcrowded with people coming in who may not actually have it.
That's right. It really is important to do a thorough assessment and evaluate an individual, because the resources in the emergency departments where many of these people would first try to access health at the hospital could be inundated with folks who really don't need emergency services, which could make it difficult for us to provide those services to those that really do.
Correct. And the drive-through screening, not yet available, correct, but will be coming soon?
We hope by the end of the week, if all goes well. We are, again, as we talked before, looking at systems and supplies and staff related to that as part of our emergency preparedness. There are some concerns across the country about supplies for COVID-19 testing, and we in Lincoln and at Bryan are experiencing some of those as well, but we've got orders out and we're trying to look at how we can best leverage the resources we have to test folks who have a positive screening and have a physician order in a safe place and a convenient place.
Very quickly, too, I want to address Bryan Health has implemented some restrictions when it comes to visitors.
Yes, we have.
Could you talk a little bit about that?
We just launched this afternoon at 3 o'clock. We have closed non-essential entrances to both Bryan East and Bryan West campus. We really are trying to keep our patients safe as well as every member of our care team safe. We don't know how long this pandemic is going to last. We need to keep our healthcare workers very healthy. So we are screening individuals as they come to the front door, looking for travel history or symptoms, and then we are also unfortunately restricting visitors to 2 individuals per patient. We really need to try to decrease the number of folks that are out in the public, and with the governor's announcement today and the president's announcement reducing groups of 10 or more, it fits right in with what we're trying to do to limit that access into the hospital.
Yes, and we want to thank everyone too who works in the healthcare industry just for being our front line against this, and thank you, Lisa, for being here, all the wonderful information. We appreciate it.
Thank you. It's my pleasure.